Historically, bone marrow is the source of stem cells, but nowadays the commonly used source of stem cell is from the peripheral blood stem cells. Hello, my name is Dr. Ng Soo Chin. I'm the consultant hematologist in Subang Jaya Medical Center. Today, I want to discuss to you something about hematopoietic stem cell transplant or bone marrow transplant, BMT in short. What is bone marrow transplant, BMT? This is a process whereby diseased bone marrow is being replaced by normal bone marrow. And there are various types of transplant. Autologous transplant is when we use back our own bone marrow. Allogenic transplant when we use somebody else's marrow. And in which case, siblings' marrow is often used. So you have matched sibling transplant or haploidentical transplant where half-matched siblings are being used. Matched unrelated transplant, meaning that from someone outside the family, is also being done. Historically, bone marrow is the source of stem cells, but nowadays the commonly used source of stem cell is from the peripheral blood stem cells, probably more than 95% of the time. There are basically two groups of patients that need a bone marrow transplant. The first group suffer from cancer, in which case they have leukemia, lymphoma, and other solid tumors, such as neuroblastoma. The second group of patients suffer from non-cancerous conditions, and basically they have bone marrow failure such as severe aplastic anemia. Basically, for some of these patients, bone marrow transplant may be their only hope of a cure, or in some cases, BMT will offer them disease-free remission compared to conventional treatment. I would like to emphasize that BMT is not without complications. The complications can arise during the conditioning regimen, can arise during the post-transplant care, and this includes infection, bleeding, and transplant-associated complications such as graft-versus-host disease. To run BMT service require physical facilities such as isolation ward. We need flow cytometer in the lab and so forth. But what is more important is to have trained medical staff, including nurses, doctors, technicians, physiotherapists, and dietitians, and so forth, working as one team to ensure the best outcome for our transplant patient.